Well, President Obama likes to tout the fact that the American Medical Association, or AMA, supports health care reform and has endorsed a version of the House bill. But how many doctors does this group actually represent? You might be surprised at the answer. Interventional cardiologist Dr. James Klemis joins us live. Doctor, good morning to you.
Hi, good morning.
All right, so we looked at the statistics, and it turns out that this group only represents about 20% of practicing doctors. So 80% of the doctors out there in America are not represented by the AMA, and the question is, how do they feel about the president's push for health care reform, specifically the versions coming out of the House? How do you feel about it, Doctor?
Well, you know, for one thing, the AMA has had a long history of advocacy for doctors, so it's not so much that we're against the AMA. One of the things that we're looking at now is the real issues. We're discussing health care reform, but an issue affecting doctors right now in the clear and present is these draconian Medicare cuts that are scheduled to go into effect. And you mentioned the low percentage of representation. Well, one of the things we're looking at now is a proposed cut of between 30 to 76% of our reimbursement as physicians that would really dramatically impact our ability to survive as practices.
But the president says that's not true. The president and Democrats supporting this plan say that, in fact, Medicare would start raising its reimbursement rates for doctors over the next 10 years, and you would be the beneficiary of that.
That would be wonderful. We were, you know, part of the AMA's discussions, that was included in the negotiations from what we understand, but that wasn't in the wording of the bill as we see it. But a real-world example that we're looking at right now is, take, for instance, our outpatient heart cath labs, where we can do procedure to look at the arteries in the heart. Right now, we are reimbursed at a much lower rate by Medicare than a hospital would be. So basically, in our settings, we can do that for about half the cost that can be done in the hospital. But these payments to us are being cut. So with the proposed cuts that they're discussing, we're going to lose 76% reimbursement, while the hospitals will gain 17%.
And what does that mean for a practice like yours?
Well, it means we probably have to close that line of service down. But we have a luxury of practicing in a very world-class environment in the U.S. I've been all over the world. I've worked in missionary hospitals in Africa. I've worked in centers in other places. And I think that our ability to deliver the care that we're used to is going to take a huge hit if these cuts go through. So
our Health and Human Services Secretary, Doctor, does not agree with you. Kathleen Sebelius has come out and said, if you look at the results of our health care here in the United States, they're not good. She says our system's not good and the outcomes are not good, and she's really not happy with the performance, I guess, of doctors and nurses like yourself. What message would you have for her?
Well, I think the message is that if you look at innovation and what we've done, if you had a heart attack in the 1970s, you came to the hospital and had to sit there for 2 to 3 months at some times, and a large portion of those were fatal. Nowadays, when a person comes with a heart attack, I can put a stent in the artery, and a lot of times they go home the next day. So the innovation and things that are driving our healthcare system are going to be seriously impacted if these cuts take place.
Do you want this bill to pass or not, Dr. Klemis?
We want health care reform. We don't want it in the present iteration. I think the concerns we have are, we already deal with Medicare and we see what it's done to our practices. We've had to lay off my nurse recently due to cuts, and you know, we don't really see them working so well in the present system and are very concerned about it being expanded to an entire system. But yeah, it's going to significantly affect our practice.
Understood. Doctor, all the best to you. Thanks so much for coming on.